stay under running soap and be careful. Okay.
And running water.
And then, okay. And then please make sure that you use a hand sanitizer.
Okay. All right.
But more so, those who don't have, and you know that you are in a position to help them, keep helping them.
Okay.
Okay.
I will.
That's a good thing.
Yeah.
But I want to say good morning to a very good friend of mine. And look, it's been some 23 years since we met. Good morning to you, Wisdom Nyako. You are the internal auditor for Ghana Education Service, Batao District. Have a great time, and I wish you and the family good time this morning. But also practice all the guidelines as we are. But we also have to tell you about all the conversations we have. We'll go into detail on all the things that we need to discuss. Obi Amwa is a member of parliament for Kapim South, but also a deputy minister for local government and rural development. We are going to have a conversation with him on how post the lifting of the lockdown, we can ensure that all the guidelines and rules we want to adopt are being implemented at the metropolitan, municipal and district assembly levels. In the meantime, also we need to adequately get to the bottom of issues when it comes to the demographics and the statistics. You heard from Dr. Nsiasare, who advises the presidency on health, that estimatedly, we know we're looking at, if everything is equal, 15,000 deaths from all this. That is, if the modeling is right. But all this is in the absence of vaccines being not available, etc. You know, so we'll deal with all this morning, and we'll bring you the latest stories on AM Biz. Stay with us. We'll be right back. And talking about AM Biz, let's straight away go into it. It's brought to you by EcoBank, the Pan-African Bank. And this morning, we have a story, and it's about the Ministry of Health having submitted some 32 herbal drugs for testing to find a possible drug for coronavirus treatment at the Center for Plant Medicine Research. A Deputy Director for the Center, Dr. Alfred Ampoma Apia, says over 60 individuals have also sent in their samples. Currently, testing is ongoing at various stages, but the Ministry of Health is yet to make any financial inputs. Ghana spends less than 0.4% of its resources on research and development, and the WHO also adds that Nigeria currently has the highest investment in herbal research.
The U.S. stocks, which had been plummeting, actually received some revival on the 13th when some level of information on a possible vaccine was announced. So the industrial stocks and the medical stocks actually went up on the Dow Jones, and as much as 8% rise in those stocks. Fast track them, these issues to Ghana. One of the things that has been spoken about is the fact that our preparedness when it comes to medicine has been missing, and less than 0.5% of our resources are actually put into research. And here at the Center for Plant Medicine, virtually no amount of money has been coming here from the central government. I have come here to find answers as to what herbal drugs are being used, or the sort of research that has been going on when it comes to herbal drugs and possible solutions for COVID-19. Do these rats come into the COVID-19 conversation?
Yes. Let me start from this point. I think we are all aware of the fact that as we speak now, we don't have a medicine that kills the coronavirus, right? So what is being done globally is that we are doing what we call repurposing. Through WHO and other scientific organizations, certain drugs that are already in the system have been selected, which are known to have certain properties, antiviral properties, and which have prospects of being helpful. And those drugs are being used and they are monitoring its effectiveness. One of the drugs that have popped up is hydrochloroquine. I'm sure you might have. A few other drugs, yes, have been done. And similarly, if you take herbs, there are known herbs that have antiviral properties. And there are herbs that treat diseases like chickenpox, measles, shingles. And these are viral diseases. And there are herbs that treat these conditions. The implication is that these herbs have antiviral properties. And there are herbs that have been worked on scientifically with known antiviral properties, right? So what we are doing is to look at
the range.
Yes, a few of these, pick a few of them, and then retest. Look at what they can do so far as antiviral property is concerned. And
so
then,
are you introducing, for example, the COVID into these mice and then using these drugs? Exactly how then does it connect?
what we are interested in is a herb that have a potential to do something so far as COVID-19 is concerned. But we are not experimenting with that virus. With the coronavirus, this novel coronavirus, you need a specialized lab to do that kind of work. Currently, WHO will not allow us to do that one. But you can experiment with other viruses in collaboration with our collaborators to confirm the antiviral property of a particular herb or of a particular product. And that, in addition to information on the herb in literature, we can indicate that it is possible that this particular herb or product can be of use in this disease condition.
How many drugs have been brought by the Ministry of Health to you?
We received a total of 33 products from the Ministry of Health, and we understand it came to them through GAFTRA, Ghana Federation of Traditional Healers. So they brought a total of 33. But as at now, other individuals have also brought some, and we have way above the 33 that the Ministry of Health brought.
The Center for Plant Medicine says that, well, they stopped counting the number of people that throng into their center every single day, claiming to have some level of drugs to help cure the that's COVID-19, and they stopped the count at 60. And just as you have seen in my shot, these gentlemen from Koforidua have also come in with some solutions. But the need for scientific centers to be resourced in order to work with the speed that is needed for an emergency, this does not exist right here. And these are some of the critical things that we will need to get solutions for pandemics like this. Budgetary allocations that come from central government every year to the center.
Well, I don't have statistics now, but I will tell you that we don't get much from the central government. We don't get much. In fact, in terms of allocations, we don't get much. But what the central government has done is that for our IGF, they allow us to use 100%. So this is an area where we use our own resources to do some of the things that we've done here. You'll be surprised if we show you some of the things that we've done through our own resources. And to be very honest, over the years, we've not been receiving the funding from the government, but we have indicated to them, they are aware of it, they understand it, and this is not the occasion for us to go into details, but then they understand what our needs are.
I like to have some level of details, because even processing these 20 drugs, I'm sure, have you been giving any resources to be able to do this work in a fast-tracked process for which you have been talking about?
We've submitted a concept note, and that is under consideration.
When you say a concept note, exactly what does that look like financially?
What it means is that you give me an assignment, and I tell you how we will do it, and I tell you what we need to do. You know, good things are not cheap, and cheap things are not good. So that's the way it is. Yes.
The WHO has indicated that Africa has consistently not spent money in its research to come up with different solutions for different problems, and for us as a continent, I think that has been really evidential in COVID. We would want to beat the time and probably make some of the biggest announcements internationally, but working at 0.73% of the contribution, and even in Ghana, research contribution is less than 0.4%. What would you say, or how would you want to push government to be more interested in putting away resources for research centers like yours?
Yes, what I would like to say is this: it's true. Over the years, African governments don't see the need to spend a lot of money in research. And you see that even when you go to the universities, when there's industrial action by the lecturers, it will be about research allowance and whatever. You are aware. So we have to spend a lot of money in this area, and that is where African governments are not spending money. Sometimes people don't see the need for research. They think everything is okay, but there's a need to continually upgrade systems, because we need, in the modern world where technology is the order of the day. So we need to do that. And I'd like to tell you that the present pandemic has exposed the inadequacies in all our systems, including healthcare, in terms of research in all other areas. And I'm very sure that the government is looking at that seriously. Because you see, what we have here, we are doing our best. You can't give what you don't have. So if you bring us something to do and we don't have the capabilities, it's not going to happen.
Okay.
I hope you understand.
So with the concept note that you have given to the Ministry of Health, have they responded? Have you started work?
What I would like to tell you is that, yes, we've been engaging them. We have been engaging them, and it's been positive. Sure.
What do you mean by positive? Because we would like to know if you started work on these over 20 drugs.
What I've said is that, of course, work has started on it, because when they are brought, we have to look at the stage in which they are, the research that needs to be done. For instance, there are some of them that have been approved by the FDA already. We need background information. We need to find out if those drugs were tested by us. We have information on it. And don't forget that these drugs that are coming in, they are looking for collaboration. And before we will agree to collaborate, we have to do background information. We have to do our research just as you did. So the work, that is how it is. So it's not just a matter of not doing background preparation. That is work. It involves a lot. You have to read. You have to get information out of it. Then you know how you go about it. That's the way it is. So yes, we started doing the work.
You were telling us how you use your own internally generated resources to fund the center, other than the addition which is supposed to come from government. exactly how would you be able to do that at this rate of a pandemic? For example, in China, when they got SARS before COVID-19, the herbal drugs were actually one of the miracles that actually saved them from SARS after killing about 100 million people. I want to find out from you, your internally generated funds, exactly how can this solve big issues like this as a problem?
Our internally generated fund, the fund is not adequate to address big issues. It's okay for us to look at our daily operations, to make sure that we stay in business, to make sure that we stay competitive. But staying above the crowd needs a lot, and that is what we're talking about. Because, for instance, now, I mean, the speed in which we expect to be doing things. Don't forget that now we have a lot of medication, people bringing things in. When they come to you and they tell you that they have this medication for and the COVID-19, you don't drive them away. And everybody is coming. We have to do that. And the speed, the resources in which we are able to do also affects it. For instance, if we go to our lab, we have lab animals that we do. So when we are conducting some studies, we cannot speed up certain things. Some of them we have to take 2 weeks, 1 month, and it has to be done. You can't short-change it. And if another one comes, we have to wait. And some of the ones that we have, you know, some do other things. I don't think I'm prepared to talk about all the challenges that we have, but I just gave you an example of some of these things that happen. So you should understand the fact that when you have a challenge, you go to your ministry. Sometimes people use the media to talk about these things, but we just give you an idea so that you understand what is going on.